Almost half the UK population, around 32 million people, should receive their first dose of coronavirus vaccine by May. The government says it expects all adults over the age of 50, as well as the clinically vulnerable and those working in health and social care, to be offered their first jab by then. Almost 11 million people have now had their first injection. The UK's medicines regulator says the latest research shows side effects from all the improved vaccines are minor and don't last long. Here's our medical editor, Fergus Walsh.
This is an immunisation production line. At Epsom Racecourse in Surrey, they're doing 1,000 COVID jabs a day. The government is so confident it will reach its target of giving a first dose to the over 70s and frontline health workers by mid-February, it's now looking to the future.
My goal is that I want us to be able to offer a vaccine to all over 50s, that's priority groups 1 to 9, by May. There's a lot of things that we've got to get right in order to hit that goal. And obviously supply is the most difficult of all of those, but we're currently on track for that.
You might get a sore arm for a couple of days.
New data confirms that side effects from COVID vaccines are mostly mild, which should reinforce public confidence.
So it will take about 3 weeks from today for your body to build up the immune response.
The 70 and 80-somethings in Epsom were taking it all in their stride.
They said there may be some side effects, but I've never ever had side effects with any vaccines, so I'm not expecting any.
My wife's had hers already, and she just had a 24-hour soreness, but that's all, and she's perfectly okay afterwards. So I'm not concerned, no.
It doesn't hurt, and I feel so secure now.
Medical regulators are constantly monitoring COVID vaccine safety. They've analysed 6.9 million doses given up to the 24th of January. There were 22,820 reports of suspected adverse reactions, which equates to about 3 per 1,000 doses. The vast majority were mild and included sore arms, headache, tiredness or fever that generally lasted a couple of days.
There are no unexpected serious adverse reactions. So the benefits of the COVID-19 vaccines far outweigh the risks, and anyone who gets that invitation to go along for a jab should not hesitate. You can be confident that these are very safe vaccines.
All medicines, including vaccines, can cause side effects. So the results of this safety monitoring are very reassuring for those who've had their COVID jab and for the tens of millions of us yet to get our invite. New research shows the Oxford AstraZeneca vaccine protects well against the more contagious Kent variant. But new variants are inevitable, so the government has signed up with a German biotech to develop future COVID vaccines to try to keep pace in the arms race against the virus. Fergus Walsh, BBC News.
Well, the latest government figures show there were 19,114 new coronavirus infections recorded in the latest 24-hour period, which means that on average the number of new cases reported per day in the last week is 19,823. That's the first time that figure has dropped below 20,000 for almost 2 months. Across the UK, 30,508 people are in hospital with coronavirus, including suspected cases in Wales. 1,014 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. It means the average number of deaths announced every day in the past week is now 985, the first time that number has fallen below 1,000 for almost 3 weeks. The total number of deaths across the UK is now 111,264. Well, the UK's programme of mass vaccinations continues. 480,560 people have had their first dose of one of the 3 approved COVID-19 vaccines in the latest 24-hour period, taking the overall number of people who've had their first jab to very nearly 11 million. Well, as cases come down and the numbers being vaccinated rises fast, more questions are being asked about how soon lockdown measures can be eased. Here's our health editor, Hugh Pym.
Surge testing in action. In Walsall, volunteers and council staff collect swab samples. It's one of the communities notified this week of cases of people testing positive with the South African variant.
It's a mammoth job, but we're getting there. The boxes are slowly stacking up. So great response from the community, so we just hope that continues.
House-to-house visits continue, encouraging people to get tested. But the overall national picture is brighter, with falling daily case numbers and in a weekly survey by the Office for National Statistics, which picks up those who are positive but don't have symptoms. The latest ONS survey of community infections suggests that in England last week, 1 in 65 had the virus. It was the same in Northern Ireland. In Scotland, it was 1 in 115. In all three, case rates were falling. In Wales, 1 in 70 had the virus, with case numbers broadly unchanged. The latest R number range, anything above 1, suggests the virus is accelerating, was between 0.7 and 1, a little lower than before. So which areas have the highest and lowest case numbers? Sandwell, Knowsley and Corby have the most cases per 100,000 people, though they're falling. The Shetland Islands, Orkney Islands and Torridge in Devon have the fewest.
I think it's encouraging that hopefully we're going, in a negative direction, less hospitalisation, less, infections. But we probably need to go much, much further before we start thinking about rolling back the lockdown.
Another survey by the ONS looks at attitudes during different lockdowns, while noting direct comparisons aren't straightforward. In the spring of last year, 81% said they were staying at home or only leaving for basic needs like shopping or exercise. But in the current lockdown, 57% say they're doing so. Compliance with hand washing and mask wearing has stayed high. 90% say they're maintaining social distancing. But the pandemic's taking its toll on mental health. According to the survey in the last week of January, life satisfaction and happiness were at the lowest levels since research began in March 2020. Mental health charities say the findings tally with their experience.
It's been quite overwhelming at times, and we're hearing from lots of people that they're struggling with depression and anxiety, worries about how the pandemic and lockdown is affecting their lives and the people that they care about.
With falling case numbers, there's a tension between the call to ease lockdown to improve people's well-being and the caution of scientists who argue it mustn't happen too quickly. Hugh Pym, BBC News.
Our Deputy Political Editor Vicki Young is at Westminster, and what people really do want to know is how soon restrictions could be lifted.
Well, talking to ministers this week, there's no doubt there's a sense of optimism that really wasn't there before. But you can also detect underlying anxiety after everything that's happened over the last few months. And that really is leading to a cautious approach. Now, what are they worried about? They're worried about case numbers. They're still pretty high, and they're concerned that if they open too soon, those will rebound back very heavily. They're worried about too many people, of course, still being in hospital. Now, of course, the more that people are vaccinated, the louder those calls grow for things to be unlocked. Now, what the government is waiting for is more detailed analysis of exactly how the vaccines are having an impact, particularly, of course, in those people who are older and more susceptible to COVID. Now, we do have some dates, Sophie, particularly for England. First of all, the 8th of March, we know that more pupils will go back to school. We also know that local elections will take place on the 6th of May. The big unknown, what will happen between those two dates? How much will be opened up? Now, the Prime Minister has promised to tell us, but I'm afraid that won't be for another 2.5 weeks.
Vicki Young, thank you.